So how many more, are you going to talk about that, Dr. Reedy, with the vaccine clinics, and how many more days do you need volunteers?
Looks like we're all in.
There we
Some
go.
about it, but ask me questions.
Also record.
Yes.
What are you
Oh,
looking
no, there, it is
for?
recording. It said, because it has the stop
Yeah, it's,
pause.
What did you need, ma'am?
After COVID shots,
Okay,
booster shot.
okay,
I'll-
Dr. Reed.
I'll bring you around.
Oh, great. Thank you so much.
Yeah, through the other than me.
They're still connecting in, connecting to their audio.
So technology. Nice one, works.
Make sure that we're the big picture. Better.
Okay. And I emailed Caleb. I don't know if he's gonna get the email or not, but. All right, we can get started because David and Ann are in. All right, shall we restart? Okay, so, well, actually,
You know, give Dr. Reedy a chance to get
It's-
back to
yeah,
the grant
it's
stuff
his-
or
his
vaccination stuff.
well, do we, well, he should be back in a second.
Check the chat.
Well, why don't we do the health administrator report?
No,
One sec, he's
this is
right
Dr. Reedy's.
He's
Oh,
right.
okay.
It works.
works.
Okay,
Beautiful.
thanks, Ann. All right, COVID.
COVID, can you pull that PowerPoint up on screen share?
let's see.
Oh, gosh.
I don't want to do anything. Yeah.
It should be there. While we're trying to get a PowerPoint up, I can talk you through what's going on.
Yeah, why don't we do that?
Yeah, so COVID unfortunately continues. We didn't know, I mean, we never know from day to day how it's going to be. There's lots of speculation, which is probably the best word I can. We were down to only 2 cases a day or less in July, and at the end of July, it started coming back up. And since the 1st of August, we've had about 3,000 cases in Jefferson County. We hoped that maybe in a month it would go down because the news at that time is in the United Kingdom, they had a spike and then it came down. In India, they had a big spike and then it came down. In India, it came down. United Kingdom, it really didn't come down. It came down maybe 10%, and it just keeps going up and down. The number of deaths in the United Kingdom, the number of deaths here is less than last winter, but it's still not zero. We had hoped that maybe I certainly hoped that maybe in 4 weeks it would be down and the schools would be able to be, getting back to much more normal with no masks or anything, but that's not happened. About a month ago, the end of October, we were seeing a decrease in cases, and we'd gone from about 40 a day at worst to about 12 a day. And about 3 to 4 weeks ago, that's where we were. Now, this past week and a half, we've been up to about 40 a day. 2 days ago, we had 81 cases in one day. Berkeley and Morgan are seeing a similar rate, which I can show you on the graphs, but we're the daily cases, the weekly average cases in the past week are where they were last year at this time, actually just a little higher. And last year was when the first big surge was occurring. The total of 94 deaths so far in Jefferson County. Still have a lot of people in hospital. Information I had yesterday was that there were about 40 people in Berkeley Medical and about 16 or 17 in Jefferson with COVID or suspected COVID. I know of other people that needed hospitalization, came to Jefferson, had to be sent to other hospitals because there wasn't any bed availability. So it's still very real. We do not know as of this moment if Omicron is in our community or not. We've attributed the big increase in the last week to post-Thanksgiving visiting surges, and we've certainly had many instances of people we talked to that they were at gatherings before or during Thanksgiving where they were exposed to others. With this, the Delta variant compared to the variants before, is we do see whole households come down with it. It's not like, well, a few people got it. It is more contagious. Omicron, we do not know what's going to happen with that because the data is still too early. Lots of speculation in every report that's coming out. The difficulty is the information in South Africa is it's a different population. It's in general much younger. So the younger people in general do well as far as severe illness. But their vaccination rate's only about 26%. Ours is not as good as much of the industrialized world where it's up near 70%. Ours in this fully vaccinated in Jefferson County is only about 49%. But it's still, better than, we do not know if this is going to lead to more hospitalizations. If people who get this are worse off, right, become sicker on average, or if they become less sick. But if they become just the same but more people get it, that's a problem because already we're stretched as far as the hospital numbers and our contact tracing, we're at about our limit there. So if we get more people getting, if it's simply more contagious and you have more people sick, the same proportion gets very sick and or dies, then this is still serious. But we just don't know yet because even in South Africa, we're really only about 2.5 weeks into when they first recognized this. And it takes about that time till you start seeing the hospitals fill up because people with it don't get sick enough to be in the hospital necessarily the first few days, but a week or so later, and then the deaths don't start occurring. So every day we're looking for some more substantial information. They are sequencing a lot of the cases that are positive that are being done at WVU. So hopefully in the next few days, we'll have information on cases in this past week with the Omicron. Given our proximity to the metropolitan areas and international airport, we are more likely than many places in West Virginia to see the initial wave of this as we have in the beginning of this disease. Our management's the same, but we don't know yet whether there's going to be changes in restrictions and behaviors. Basically, it's the same things it's been all along is restrict your interaction with people not part of your core group. And that's good as we go into holidays to really be considering but I don't know. We are continuing to give vaccinations. Tomorrow we have a vaccine event at the Ranson Civic Center for children can walk in. So this is the 5 to 11-year-olds. And then adults from Moderna, we asked them to schedule because we we know we have about 100 people already scheduled for it. And if we just have them all coming at one time, it creates chaos. We learned that last year. But so people that want to get Moderna vaccinations, either boost doses or first or second doses, we can do that without an appointment between 9 to 12. If we find that there are a lot more people scheduling, we can extend that time a little bit with people. It's a mixture of staff and volunteers. By the state numbers, we're doing a little better than many of the counties as far as our numbers of children who have been vaccinated. It's about 14%. A number from the Kaiser Foundation makes the state numbers about 13% on average, but the Kaiser Foundation published some information that West Virginia was only about 4%, one of the worst in the nation. So there's, as has been for a year and a half, there's some difficulty knowing what numbers come from where. We at least can look at our numbers of people we've actually vaccinated and say, we know it's this much. And so we know we've vaccinated probably close to 150 people, children. The numbers of people getting boost doses is in the 60 plus age group, which is the group we really want to get it, is still fairly small. I think it's under 20%. So there's a lot of need for that out there. We are seeing, more breakthrough cases than we did earlier. Breakthrough deaths are still small. Breakthrough hospitalizations are less than unvaccinated, but there's still a concern. And of course, the big unknown is whether this new variant, what interplay that has with the vaccine effectiveness. So we're not over this yet. We certainly hoped by now we would be.
Do you have dates in the future that you need volunteers?
We do not, because the demand is so variable, is that there's certainly a great number of people that would benefit from more vaccination, or by who we're recommending it for, who haven't gotten it, if you want to say it that way. But it gets hard to staff stuff. The Ranson Civic Center is agreeing, to work with us on providing space. We are not having people schedule for this as quickly as they did for the earlier event a few weeks ago. We had a lot of people, but across the state, they're seeing that as the demand for boost doses has decreased. We hope to change that.
The number of boost doses that you quoted, is that also including the Walgreens and CVS?
Yes, that's what's being reported to the state.
Mhm.
And so it's, certainly early this year, there was a great need because there had been no vaccine, no protection. And people's acceptance of the COVID is very different than earlier. It's still just as dangerous. And I do recommend the booster dose, and hopefully it will continue to decrease the likelihood of, especially the over 60s, who are the group that's most affected for serious illness.
What about testing?
So testing is available in the different areas. There's the biggest area is the state pays a commercial laboratory, West Virginia Laboratories, which is out of Charleston, and 6 days a week they're doing testing here. It's a saliva-based test. It's just as accurate as the nose one. And we're getting the results usually 24 to 48 hours afterwards. And they're doing about 50 a day of them. The Monday through Thursday, it's at the racetrack garage, the casino garage, parking garage, and then Friday and Saturday, the hours are at Shepherd University Wellness Center. A lot of the urgent cares are doing it, but you get evaluated, so there's
Yeah.
a medical bill as well. Home testing is valuable if you can find it, and hopefully that's going to increase. The home testing doesn't show up in the state system because it's not being done by a lab, but it's mostly a good screening test that if you come down with COVID symptoms and you test positive on the home test, then we recommend you, of course, isolate from others, but also go get the spit test, which you can do, or another test if you're sick, get evaluated. And that makes it more definite that you have it, which is, it's good to know if you have it. And then also it's helpful if you really have it to tell those who you were close to that they need to then take cautions. We do see several people a day that get positive results who got tested here at the West Virginia laboratories that actually are from Virginia or Maryland that came here because they couldn't find a test in their area.
Yeah, and it's an issue here. I know I've had it personally in terms of trying to get to testing. And I know other people who have had trouble getting access to testing either.
Well, the testing to travel, if you're not sick, the urgent care down by Food Lion will do that. Their last specimens leave, I think, at about 4:00 to go to the lab. So it's $40 and they will do it
It's cheaper than what I was
basically
paying.
without an evaluation. You can just
Okay.
go up to the counter and.
Do you have to call in ahead?
Well, I called and got all of the details and
Okay.
all of the information because when I was traveling, it needed to be within 72 hours.
I have the same
And I
thing
was
coming up.
leaving on a Sunday, so I waited until almost the last of the day on Thursday so that it would be, late in the day that the specimen was taken. And it was back in email in about 4 hours.
Oh, okay,
$40 is,
all right.
but they, you can call them, but at that time they were collecting them about 4:00.
So it's just sort of, in DC, they've got quick testing, Northern Virginia has it, but I've, several situations, like I've been in a space where someone's, I've been notified, I've been close to somebody and I'm sitting here going like, I have to go to Virginia to get a test,
Well, you can go there.
So I can go there,
Yeah.
good.
So you
Okay.
can also order the home tests.
We
They're,
just got those, yeah.
Through Amazon
Yeah.
or something, and they're good to have. A year ago, they had thought about this being an option that people could test at home every day before they go to work. If it was
Mhm.
$2 a day, some people could afford that, but the cheapest is about $12.50 a test. But it is still a valuable test.
Yeah.
But those are not legitimate for
Not
travel.
for travel.
Right, yeah, because
But
because
for when
it's
I'm in
easy to
contact,
falsify the
though.
result because
Yeah.
you're doing it yourself and you're saying, yeah, this is what I got.
Yeah, for me, it's just more because I'm in crowds and
Mhm.
so I've had to go get tested several times over the past few weeks just because.
So Walgreens locally
Something
and
popped.
some of the CVS's do tests, but the Walgreens do test. and
Yeah, but
their
it usually
results are coming
takes
back in
2
a-
days to get an appointment and then it's another 2 days before you get the results. It's like, okay, now I'm
Yeah.
in 4 days. So, yeah.
So Dr. Reedy,
What's
while we
last
add
free
that
testing, it does
subject,
take they were coming back in 24 hours last week, I know.
Okay.
But that, you don't need appointments for that. and They
Okay.
are there 6 days a week, so.
And we are manning that.
No,
We
it's,
don't
the lab
plan
does
it,
it.
The lab
So
does
we-
it.
We answer, we
Oh,
get the
okay.
results, it's done
Okay,
as me as the ordering physician. and We
Right.
get the results and we handle calls when people can't get the results. And
okay,
And our other role in that was just to find the locations that they
Right.
could use. So, but it's a contract through the state pays them to do this. so.
Okay.
And we continue to use them. Some counties have switched to something else or they're not using the West Virginia labs or other free testing right now, but we've been using them for several months. and-
okay. All right. Thank you.
I went there
Dr.
too.
Reedy?
I got both, waiting to see if there was one that came back slower than the other
Right.
one. And the one from West Virginia Labs was about 24 hours when I needed that one for travel.
We've got a chat up there. Can we look at that? It works. Okay.
Yeah, so that was just.
Gotcha.
Doctor, I have a question for Dr. Reedy.
Anything else on the?
I have a
Sorry.
question for Dr.
Uh,
Reedy.
No, so it's still a lot of uncertainty and it's still very real.
And I would continue to say, from my perspective, that the risks for 5-year-olds, anybody under the age of 18, that the risks far outweigh the benefit, in my humble opinion.
The risk of not being vaccinated,
No, the risk of vaccinating a child.
just so we're clear.
Yeah, that a child is much better off not being vaccinated than being vaccinated. That's my opinion.
All right, moving on to agency activity report. Oh, wait, I'm sorry. Anne has a question for Dr. Reedy. Go ahead, Anne.
You guys hear me okay? So Dr. Reedy, I had a few
We can't
parents.
hear you.
Make
Yeah,
sure
uh,
that our speakers are set up, bottom left, yeah, in there.
I'm on.
Speakers, Realtek, high definition audio.
I'm connected.
And test the speakers.
All right, Anne, can you try again?
Okay,
Here
you
we
hear
go.
me? Okay, so I have a few parents call and complain to me. So Dr. Reedy, you talked to one of the parents sometime last week, and they really upset that the system, the quarantine process seemed to honor the rapid test. So if the kids sick, they took the rapid test and they called the health department. I mean, they being honest about it, but when it's come to the other way around, when the student is asked to be quarantined and they took the rapid test and they showed negative and they took two of them 3 days apart, and they still make the student stay home on quarantine, and they say that it's not fair because if they honest enough to test as positive and call you guys, and then you should honor the negative test as well. So can you explain more about the quarantine process, because they really upset at us.
So
I
the
agree.
question was that there have been parents who have been concerned that when they have a positive test, a screening test, their own home testing, and they report it and have symptoms that we
LGTV.
working.
Yeah, the microphone should be fine.
That and that we give them advice to get tested by the confirmatory test and to isolate that when they do the same with their children, we're not accepting the results. So the guidance has not changed in a long, long time on this. The treatment, the recommendations for people who are known to be infected are different than the recommendations from people who are exposed for a couple reasons. But so just taking it through regular testing, people who are infected in have an average course are considered infectious, meaning they could transmit it to others based on virology studies and time, and based on people who have had infections and people they've exposed and how long after they got infected. So they are infectious up to 2 days prior to developing symptoms and for 10 days after. Now, people who are extremely sick or people who have very weak immune systems could be infectious longer than that. But for the average person, 10 days afterwards is considered the point at which they are not likely to infect others. The closer you get to the 10 days, in general, the likelihood of it being infectious is less. But if you start talking about 80 people a day and you're letting people back at day 7, then you're letting some infectious people back. The home test is not done by a certified laboratory. And unfortunately, when it's simply someone reporting, just like I reported my temperature and it was fine, that's not always accurate or true. So the laboratory result needs to be, for confirming, needs to be that a person got it through a reliable lab. For testing people who are exposed, if I'm exposed today to someone who clearly has COVID and I'm clearly exposed, we were together a long time, they were hacking and, family member or something like that. And I'm highly likely to get it, that could be as early as 2 days later I get symptoms or as late as 14 days later. So that's my incubation period, like a seed being planted. It just takes variable time. After 14 days, if I've had no further exposure, then I'm considered, if I haven't had any symptoms of it, I'm considered safe. If at day 10 I develop symptoms, I need to get tested because then I may have it and then I need to isolate for 10 days. What happens in isolation and quarantine are the same thing as you stay away from others. So if I get exposed today and then I have no further exposure to this person, I leave my home and I go live in a motel, let's say, I have no further exposure. My 14 days starts, the next day. If I continue to live in that situation, then I continue to get re-exposed every day that person's considered infectious. So I then need to start I need to quarantine that whole time, but it starts again when they are finally no longer infectious, because I could get infected on day 9 of their illness. And it does happen. We see people who know they were around someone and they say, I was fine, and then 10 days later they get symptoms. In general, after day 10, it's very unlikely someone who had no symptoms will develop. So the quarantine has decreased a year ago from the 14 days to 10 days. In a home, it's very hard, especially if you have little children, they have to have contact with each other. That's just how they are. If you have a teenager, they may be fine staying in their room for 2 weeks, not near anyone. That may be perfect for them.
What teenager is that?
But each person's different. So
I guess.
So it's been from the beginning, very difficult. And so the 10 days was one, but then there's the 7-day test out option where at day 5, after your last exposure, 5 days later, you can get tested. If that test comes back negative, if after the 7 days you have no symptoms and your test was negative, then you can be released from quarantine. But that's got to be not the antigen test, which is the usual rapid test and is definitely the test that's done, but the PCR test, which picks up more cases. So a positive, so someone who's got symptoms and is in a high transmission area, which most of the country is, and they have a positive rapid antigen test, whether it's home-based or office-based, that's likely to be true. If they have a negative one and they've got symptoms, it could well be false. So it gets complicated, but the home tests are not acceptable for being cleared of the possibility of infection. So it gets very complicated, and we try and individualize it as much as possible, but the isolation and quarantine are great disruptors. For the most part, we've been able to keep people in schools. We're not very often closing a whole classroom. And we're not seeing much in-school transmission. The majority of kids are able to stay in school, and we hope it continues if a more infectious variant comes. But it's very disruptive. But throughout the state and the nation, the question of, what do the home tests do? Well, they help you know if you're positive that you have it. As far as someone that's symptomatic, if it's negative, that may not be a good enough answer.
Thank you.
I hope that it's a complicated issue because there's so many variables in each case.
Yeah, I totally understand. I just want to have you clarify it at the meeting so that more people in the public, if they want to ask questions, or say, here's the video, you can listen to this, or so it's faster than me sitting down and try to explain to people, and a lot of time, I'm not as eloquent as you. So thank you.
Yeah. So we do feel we feel bad to deliver bad news to people.
Especially friends, so they can just curse at me. Thank you.
Thank you.
All right, I think now we can get into the administrative report.
I'll keep it quick because there's a lot going on after me.
Okay.
So like I said earlier, we invoiced for our quarterly state aid disbursement. It's about $92,000 or so. And as I said to Ann a few minutes ago, slowly coming up to speed on the financial details that make up the monthly and annual revenue and expenses. That's something will probably be the last thing, unfortunately, that I can remove from the previous administrator. Marty's been a great tutor, but we're obviously moving away from Marty with the accounting firm too. So once we completely transition her away, I may call on her occasionally in a consulting role, but she'll be less involved on a month-to-month basis. So the one big announcement, and I know that you and I have spoken about this before, Karen, Laura Shepard, our nurse director, she tendered, and then I accepted her resignation on Monday. It was effective for today. Since her resignation occurred during her probationary period, we didn't have to have any reason for her to leave or for her to be removed from her position in any way. So she, like I said, she tendered her resignation and I accepted. So we'll make sure we pay her out all of her unused leave and comp time and treat her well, like we would expect to be treated ourselves. So we'll do that. And we'll immediately begin the process of finding a replacement. But immediately starting the search doesn't mean we will be immediately hiring. We'll be very choosy on this next one. This is an important position that requires a lot of leadership ability. There's established staff here. You can't just come and run roughshod over them. They will not accept that. We have to have somebody who can come in and get buy-in from our current staff. And we'll make sure that we find that person. Second, or the third thing here is the grants. We talked about that, System for Award Management stuff and all the scary stuff that's going on with the federal government. And they're not as easy to work with as they should be. So we're still waiting for some grant disbursements going forward, and that's going to hit our books and change, I believe, financially. It will change some of the numbers that you're seeing in the October, November financial reports. So, and then the last thing is the timekeeping software. I have an appointment, probably they haven't set it up with me next week we're going to sit down and we will start developing the system that we're interested in. So that includes making sure we bill out grants, have the ability to bill out grants and separate grants and all those things, and all the things that will make timekeeping a lot easier, not only for our finance technician, but also for every individual employee in the office, and the ability for them to maintain and be responsible for maintaining their own timekeeping. So Once we get all that in place, I can probably share with you the details going forward, but we haven't decided on all the little nuts and bolts of what that timekeeping system will look like. It'll be available on PC, it'll be available on cell phone, depending on how you feel like you're doing, or you can have both if that's your right, you'd rather do that. So, or on your whatever other type of portable device that you might be using, laptop or anything like that, so you can sign in multiple different ways. So, but that'll leave it to the employees, not to someone individual or two individuals to chase all that down. That'll be up to them. It'll be on them, and I hope that they will understand the responsibility of that. I think they will, because it'll affect their pay. That's the way that
Good
works.
incentive.
Very good incentive.
Okay. Anything else on the health officer side?
I do not have any.
Oh, I did have one more thing, sorry. Monday, we're having the insurance billing contractor come in. We have a lot of Medicare and some private insurances to bill. We're gonna try to
Okay.
bulk bill it, and we'll see how that hits the bottom line too.
What is their, do you know what they sort of take off the top for their
Well, we'll
services?
discuss that, yeah. It's worth it if they can do it in a much more timely fashion than us,
Sure.
so. But going forward, that's something,
Mhm.
by taking a lot of the timekeeping away from individuals, that'll free them up to do some other things, I believe. I hope, including this.
So this is billing across the board. It's not just vaccinations. It's whatever billing for
Whatever
whatever
other billing,
service.
yes.
Okay.
Making sure that we are not only proficient at it, but that we clear any backlog.
Okay, great. Thank you. Environmental?
Okay, so I did send everybody out the activity report for November, so you can
Thank
see the environmental activity on there. Numbers are picking up a little bit. We still need, more personnel to be able to get our food inspection numbers up to where they need to be, which we're working on, so.
I saw the new food permits numbers were like at 7. Does that mean we have 7 new restaurants opening, or what is that?
Yeah, that is what that is. So some of it is just change of ownership though.
Ah,
So it's
okay.
really not new. Like 3 of our 7-Elevens changed ownership, so we do require
Gotcha.
plan reviews and new
Okay.
permits in their name. So some of that is that.
I see. Okay.
Explain the bed and breakfast permitting as well.
So the Airbnbs, we are also, some of the new permits are for Airbnbs because we just recently discovered that we are supposed to be permitting our Airbnbs where it's not the primary residence of the owner.
Oh.
So the state requires us to permit them under our general sanitation regulations, which also covers hotels, motels, and bed and breakfast. They're not bed and breakfast. They can't be classified as a bed and breakfast because it doesn't meet the specific definition of serving breakfast and having lodging. So, but a lot of the Airbnbs we're working on getting permitted. So we just the reason we discovered that is because I had somebody from planning and zoning ask me about it because they were changing a zoning text amendment in the county. So in their text amendment, they are including that they need health department approval to get basically to get licensed that way in the county. So there's been a lot of confusion over that, and I've had a couple meetings where we've been discussing that. The state actually sent a memo out, I guess, in like 2017, 2018, 2017, so before I was even here. But I had asked the state about this once before when it came up with Harper's Ferry, and the answer I got was we weren't gonna do anything unless they were serving food. And then this last time I asked them, they sent me this memo that says, yes, you are supposed to
Oh,
be.
interesting.
So,
I have a question.
yes.
And that is, for an Airbnb, what type of permit do they have to acquire?
It's basically, they're gonna be classified as a motel for most instances, is the definition that they'll meet under our general sanitation regulations. So it's a general sanitation permit, and they'll be defined as a motel for most of them.
And what's the process? And how do you know if there's an Airbnb that hasn't complied?
That's, people are either coming into us because they're hearing about it, or where it's very difficult to just find online, because we don't know, for one, if it's the primary residence, we don't know, two, who the actual
So,
owner is,
so
especially
if
on the
it's not,
Airbnb
if it's
website.
not their primary residence, they don't have to get the permit.
No, they do.
No,
have
they
to.
do, if it's not their primary residence, yeah,
But if it is their primary residence, they don't have to.
right,
All right, so,
and they're not serving food. If they are serving food, that's a whole other thing, and
Right.
they have to get permitted,
so they'd be classified as a hospitality unit in essence, a hotel, motel, and so what's the process? Can
So-
they find the application online? Can they,
Yes.
and how much does it cost? And
I don't know the fees offhand. I don't collect
$125.
fees, so I don't know the fees.
125.
it's 125?
Yeah.
Thanks.
Anne actually owns one Airbnb, so
But I've got a
she
permit.
did, when she
Well, that's
mentioned
cool.
it to me, I told her, hey, I just
Uh-huh.
found out
Yeah.
that we're supposed to be permitting Airbnbs, and she submitted her application. for
This is
it.
good to know, and this should actually get out to the HOAs.
It's already out on mine,
It is, okay.
yeah,
All
because
right.
I had two that were unpermitted in my neighborhood.
Yeah,
So I
You
mean,
probably
it's
know who they
out
are.
there in the county. I think I think most people have already heard about it, and a lot have contacted us, but not all.
so you send an inspector to make sure that the septic system is working right and
So
that,
it's a whole bunch of things that we're looking at. They're not all on septic. Some of them are, some are not. If they are on septic, we basically have to make sure their septic system is sized appropriately, and they actually have a permanent septic system for their residents.
and how long does, if somebody applies for the permit, can they still operate while they are waiting for somebody?
Yeah,
to-
we're not shutting them down. This is something we just
Okay.
found out about. We're not trying to say you have to stop operations until you do this.
Right.
We're going ahead, and when they find out, or when we find out, we're notifying them. We've got because of complaints, so we had a list of people to contact because we've had a complaint from somebody saying they're all operating without a permit, so.
Right.
So we've been contacting the ones that we are aware of, and like I said, we can't really contact them from the Airbnb site. There's really no way
I
to.
I'll send the link out to the Harpers Ferry Bolivar merchants.
Yeah, there was some
Bunch.
confusion with the town of Harper's, or it was either Shepherdstown or Harper's Ferry. One of them was saying that they was telling them that they didn't need to get permitted, but that's not true. They still need their health department permit. They don't, the town text amendment, or the county text amendment doesn't apply to them, but they would still need a health department permit if it's not. their
Per
primary
state law.
residence. Yes. So there was confusion over that, which I've addressed to the people who have asked, so. And we do have information posted online about it on our website.
Yeah, I'm pretty sure they told me at Bolivar that we did not need to have.
Right, and that's what we had heard, is that they were telling people that, so I got in touch with somebody there and said, hey, that's not the case, so.
How long does it usually take to get a permit?
So it takes, 2 weeks or so, yeah, right around 2 weeks, so. Once they submit everything, we have to schedule somebody to go out there after they've reviewed everything.
Well, this becomes harder on you and them because
Because
it has to be scheduled at a time that there's nobody there as well.
There's a lot of
Right, we can't,
Airbnbs.
because we're not supposed to
cropping up.
go into rooms that are occupied
Yeah.
when we're doing these types of inspections, so.
Yeah, that's actually a new thing. It's a trend. There's a lot of B&Bs cropping
Yeah,
up.
there is.
And
so-
Jefferson County is a
yeah.
big tourism destination, so Airbnbs are becoming more popular here.
So, and then I think as far as my sanitarian briefing for Karen, and she had asked several questions, and I know that there's some confusion over some of the things that we do as sanitarians. I did send out a bunch of information. I sent out all of the well, not all, but most of the regulations that we are tasked with enforcing. Most of those are state regulations. We do have some county regulations as well, local ordinances. I think you all have a copy of the local rule that includes some of the environmental.
That was helpful, by the way.
Yes.
Thank you.
So, and the other thing I did send out to you talks about what sanitarians have to meet in order to be licensed as a sanitarian in West Virginia. And I also sent out a list of licensed sanitarians who are almost all employed. The couple that aren't are retired and really they're just maintaining their licensure. We have one in the area who used to be the district sanitarian here, but he's contracts some with the state to do a little bit, and he maintains his licensure. But other than that, like it's hard to find a sanitarian that somebody who's already licensed as a sanitarian that's not gainfully employed. So as far as contracting out sanitarians, I don't think it's going to be a viable option for us.
Like I said, Simon Sanitation Services.
You know, but.
I know, and a lot of people get confused about the word sanitarian and what does that mean?
Mental health.
But it's a lot of states, there's a lot of states that still call us sanitarians, but a lot of states call them environmental health specialists, which is, I think, a little less confusing for people to understand what we do. But here in Jefferson County, our sanitarians, we go through several weeks of training through the state, and that's training on all of the regulations. We also have on-the-job training for food safety. The state doesn't really do any on-the-job training for septic unless you ask for it. That's normally you're just trained by somebody in your department showing you what you need to do. But basically what we're doing for well and septic, the on-site work, is we have to do site and soil evaluations anytime we get permit applications to make sure that the soil is going to be able to have a septic system installed in that soil. So the soil has to be free of rock and free of water table, and a lot of times we get pits like with standing water and stuff in them. So they have to meet certain requirements for the soil. And also the other thing that we're looking at, and we run into problems a lot in areas like Shannondale where the lots are small and there's a lot of things up there, is they have to be, any septic systems have to be at least 100 feet away from neighboring wells.
Mhm.
And that ends up being a problem. So those are the types of things that we're looking for when we're doing these evaluations. We have to evaluate a 10,000 square foot area for all new lots to make sure that whole area is good, because that is the area that they're going to be using to install their initial septic system, and then in the future a new septic system when that septic system fails, because eventually it will. So for septic work, that's what that entails, and it does entail a lot of training, that on-the-job training with the other sanitarians in the field, teaching them what they're supposed to be doing before they can go out on their own. Lexi is fully trained now, so she did complete everything. She doesn't have her official licensure yet, but she has already had her week of on-the-job training with the state, and she's ready to go on her own.
So we have two now.
Yes. To Jen I still call. She's like my 3/4 employee because she's going to school, so her hours aren't officially full time. She works 30 to 35 hours. Typically, she tries to work as many as she can, but yeah. So I have two, and then myself. So, which right now, I've been adding on some complaints and some of the plan reviews.
So if somebody sells a house that has a septic system, does the new owner have to get re-evaluated, approved?
No, if that septic system's already there, there's no reason that when houses are sold, I think sometimes, and no, it's only when there's building. So it's not when they're just sold that they would have to get any
So there's
evaluation.
an active building.
Yeah.
Okay.
It's only for building. So if they're doing a renovation or something, they have to, the building department's going to send them to us to make sure that their septic system is sized appropriately.
And then what about, like, and I think we talked about this a little bit last time, was, people that have developable lots, they get their permits. And I saw in the statutes that you'd sent along, or I don't know if it was statutes or rules and procedures, but you know, the permit's only good for whatever, a year or 2 years, I think it's 2 years, is it?
They're 1 year.
1 year, okay, so you know, I have a developable lot, I've actually made it now building ready, you know, like there are companies that go in and get stuff sort of like graded and services put in. Does that transfer, if it's within a year of getting that permit, does that permit transfer to the new owner that is now gonna go put up a house or a building or?
Permits are not transferable, so anytime there's a new owner or a new installer, if the permit was issued within a year, really all we're gonna do is reissue a new permit. We don't feel the need to do another site evaluation
Okay.
when we've been out there within the past year. But if it's been longer than that, because a lot of times we get permits from several years ago where they're trying to renew them now because there's either a new owner, so they're trying to renew that permit or before they sell it, either way. So we have to go out and do another site evaluation and make sure everything is still good. And if we have to make sure that we have certain information in the file before we issue a permit, because we're now issuing that permit in our name. And before we do that, we're going to make sure that it's good.
But back to your question of selling a property, typically the septic tank is pumped and a copy of the permit is included
Mhm.
for the new owner.
So, and do you have any other questions about septic before I move on?
That's sort of the biggest area I
I
really don't know,
know,
like
it
food is
is.
a little more intuitive, but.
And you're welcome to just email me anytime you have any questions about.
Yeah, I just want to have the right answer when people, because like I said, that's sort of the big questions or things that are brought up when I'm out and about. And
We
I'm
do
like, I don't
have-
really know.
We did, in the past, our board has created policies for things like a previously permitted lot. So we do actually have a policy in place that we follow for those.
Okay,
So
did you send that in there?
I don't think I did.
Could you
send
shoot
so I'll
that to me
send
too
you.
then? That would be
Yeah.
helpful.
I will.
That'd be great.
So we do have a policy for lots that have had previous approvals, whether it was, there were need fee letters in the past that were sent out and past permits and things like that. So we do have a policy.
Yeah, thank you.
Something that was approved 10 years ago, and you go back out there and re-inspect, and they built something in a place that was so things change over
Yeah,
time.
sure.
And I look at a lot of the septic stuff as more building codes, is that these are, but the difference is that one of the materials, the soil, is actually more of a living thing, and it's very, very different, and you have to actually look at it.
And our soils in Jefferson County are very unique compared to the rest of the state, so. So yeah, that is a big part of what we do back here. It takes up a lot of our time. There's a lot of new building going on, and we're expecting there to be even more new building going on in the coming years, so.
You said our soil is unique?
Our soil structure is unique in Jefferson County.
How
It's
so?
the karst
Oh,
with
okay.
the, yeah.
Yeah, gotcha.
So
Just like everything else with Jefferson
We
County.
can
we're just
show
the rest
you
of
a
the state.
soil
We're
map.
We're always unique.
Soil map.
No, I'm aware of the karst.
Can you just mention what happens if someone is denied a permit?
So if anybody is denied, say, if they applied for a class 1 system and we're denying that because the soil's not, if there's a problem with the soil, there's a problem with wells being too close, or some other issue, we write a denial letter. So that denial letter is very specific. It tells them exactly why it was denied. We give them, if there's any options for applying for a class 2 system, we tell them that they have that option. And usually they have already been told that when we're on site, and a lot of times those class 2 applications are already in. There are times when we have to deny it completely because there's nothing that we can do for a class 1 or class 2 system on the lot. If that's the case, they're going to have another letter. That letter details everything. It gives them the appeals procedure on every letter that we send. Those letters go to the owner and the installer. So they're very well informed of exactly why it was denied and what the procedures are for appeals.
And the appeal is, it
And
goes
the
to the medical officer, if I remember correctly.
Well, what was approved by the board was that, yes, it typically goes to the medical office, the medical director first. However, they do have the right to appeal directly to the board if they wish, and that's part of our approved, what the past board had approved for the appeals procedure.
And it's time limited, and they can't.
Yes, they only
Right.
have 30 days from the date of the letter
To appeal.
And those letters are typically sent electronically
Mhm.
and mailed. So,
Okay. Thank you.
so
I
that,
appreciate it. Thank you.
you're welcome. Did you want me to tell you, the national standards that I referenced, those are voluntary national retail food regulatory program standards. That is, it's a voluntary program that a lot of jurisdictions are enrolled in because they're trying to improve their food safety program. And that's only for the food safety program. So those are all the grants that we've applied for on the environmental side. I actually just applied for $250,000 worth of grants over a 3-year period. Hopefully, we will get approved for that. We'll find out. It's a new funding source this year. So then that will actually fund another sanitarian position over the 3-year period if we get approved. That's why it's
And
so
Bob
much.
Custard's filling out some of those grants too,
He did not, because this time I had to apply for them because Bob is working with NEHA and he's basically reviewing some of these grants and doing some other things. So he had to write a statement of what he was allowed to do. He's still going to be allowed to help in our mentorship program if we get approved for that. In order to get the mentorship grant, we first have to get approved for the base grants that I applied for. I did apply for the mentorship grant this year as well as this training grant. That would be in addition to the $250,000 base grant for 3 years. So we'll see. They're supposed to be reviewing that all this month and early next month, and hopefully we'll find out soon about that. But that's what I'm referring to when I talk about those standards, and that's to make sure that we have a standardized approach to our food safety program.
Yep. And then, sorry, I know I asked this question. I think I asked this question last time. If, Joe Smith in town wants to become a sanitarian, like I know we train if somebody's applying or working for us, but can Joe Sanitarian go and take the state course
Well,
and pay for it himself, or?
I'm not sure exactly. Do you
Joe-
mean if I hire somebody?
No. Joe Sanitarian wants to have a certificate because he wants to be more employable, or he wants to maybe become a sanitarian, but maybe he's at another job right now in the hopes of changing careers or whatever the case is, but instead of getting hired here first to then work on his sanitarian license, can he just go to the state and say, I want to become a sanitarian and go through the course?
No, they for most of the courses that the state offers, they don't open it up to anybody. You basically have to have been hired as a sanitarian in order to take those state training courses. So they opened, I think they opened the septic one up to everybody, but it was basically, they opened it up to other sanitarians to get continuing education.
Okay.
So it's not typically something that training is only for sanitarians. The state provides it for sanitarians. So you have to be hired and you're called a sanitarian in training for the first
Right.
2 years until you become a sanitarian after having 2 full years of experience and completing all of those training requirements.
Do we pay for that training or does the state pay for that?
We don't pay the state anything just for the training. What we're paying for is the travel.
Right.
So the state.
Good. So one more thing, is there any educational requirements beyond being a sanitarian? Are you required to have a bachelor's degree or anything like that?
Yes, you are.
So-
Really?
Sanitarians have to have bachelor's degrees. In West Virginia, they don't require the science background. You would be required to have a strong science background in your bachelor's degree in order to get the national certification, the REHS test that I took. And you can become an RS in Virginia, but West Virginia, but West Virginia also has, they do actually have an educational requirement too, and I'm not sure exactly what they look at in your your credits. But yes, to hire a sanitarian in West Virginia, they have to have at least a bachelor's degree. And we usually look for somebody with a strong science background when we're hiring them.
Thank you. Any other questions?
Yeah, that's when I went to her and I said, I want to be an RS. And she's like, you can't.
I said it's not
You
that
can't limit
easy.
me. But that means I would have to work full-time for 2 years
Yeah, he
as a
couldn't
sanitarian.
just
In
take the
addition, like I
test.
said,
Yeah,
I just can't take the test even though I work in the health department.
right.
So since we don't have our nurse director, we're gonna do the clinical activity report, right?
Okay.
All right. Everybody got the numbers. We had 27 family planning encounters. We had 7 STD encounters, and all 7 were treated with medication. For the month of November, 54 vaccines administered. It's actually got to be a lot more than that. Yeah, see, we're talking about COVID-19 outside of COVID.
Outside of, yeah, that's
of
what I
COVID.
figured that number was.
Yeah, that's way, I'm like, we do like 15 a day sometimes. So harm reduction, no, because we're not involved in that right now. So we had some TB, 14 scheduled, 12 seen, 2 did not show up. Produced 1 screening letter, and then reported 1 latent TB treatment to the state. I don't even know what Campylobacteriosis is. I'm sure Dr. Reedy does.
So actually, I've been assigned most of the Campylobacter and there's also recently.
Salmonella.
Yeah, there's also recently been, now I'm blanking. What
Vibrio.
Yes, Vibrio cases that I've been assigned. So those are epidemiological investigations that get assigned to our office. The nurses used to be responsible for all of them, but now any that could be food or waterborne are being assigned to me. So
And your team, right?
me,
Just you. Okay.
me.
Lucky you.
So my team is too busy doing other things. So yes.
And then for the month, the big number obviously is the COVID-19 vaccination total of 643.
Okay.
So,
Thank you.
which is not bad.
Yeah, so these foodborne illnesses are all ones that could have come from the supermarket, could have come from a store, could have come from a family member that inherited it. So it's
Thanksgiving dinner.
And the timeliness of it is something we've not done as well as we should. And you know, that, one of our grants looks for hiring an epidemiologist who would do this.
All right.
I know.
It would be really nice to have one on staff to help with these things.
Those things are in the works.
All right. I know we're running quite long today, so threat preparedness,
Yeah, I'll keep it quick. So we've been.
hopefully no threats.
There aren't any
To be
threats to
prepared.
report really. We're just mostly doing vaccinations right now.
Okay.
So I've been doing the logistics, people come in with their insurance, I scan it,
Mhm.
and I print out all the stuff, then we match it to the person's their paperwork
Mhm.
regularly. And then I guess the only other big update is Dr. Reedy and I next week are going to go through the all hazards plan. It's included in one of the grants that we have. We're going to go through and review it and then submit it. I think they have the new Google Drive for it up. I just saw it the other day.
And we can send you copies of that. It's a
Yeah, we can.
comprehensive thing that goes into lots and lots of stuff, but we have to be sure contact numbers and all that are what we're really dealing with.
Right.
Yeah, that's the big thing now. Like I've reviewed most of it. We don't need to make any major changes. It's just the contact information.
And we're part of a region of several counties in this part of West Virginia that I think about 9 counties. That's a threat preparedness response. So we submit it to the regional coordinator who then submits to the state.
Well, the Department of Emergency Management actually publishes a threat assessment. Is there coordination that goes on? Is there input from you? I mean, is this separate? Is it redundant? I mean,
Yeah, so we'll meet with Steve Allen. He's over at the EOC. We'll work with him
right.
on that.
So you publish one though that's separate from his?
So
Each agency has their own plan. It's just part of an integrated plan. And so this is the health department's
This is
Yeah,
what you
version
do,
of our
this is what we're gonna be
responsibility.
responsible
I
But
got
we
it.
also need to, be planned, because his will say
Integrate.
which agency is doing this and which agency is doing that.
So he's got the master plan and everybody else kind of like contributes to it?
Yeah, it's
Yeah,
a
that's the
choreography
idea.
of
Okay,
how you-
all right,
how
then,
you do it.
all right. Thank you.
Great, thank you. Thanks, Mason. All right, so we've already gone through the review of the financial reports. Do we have any other further discussion on that?
I didn't mention it at the time because the news was all good, but we did receive the audit from fiscal year 2021 and it was clean.
Great.
And I have bound copies if anybody wants to look at them. They're
So are we?
very
gonna-
nicely done.
Are we gonna move this item into
Yes, for next meeting.
for the Cox Holland, Young
Yeah.
update? Okay,
But do we need a motion?
But
to
we do
accept
need a
that?
motion.
Yeah,
I'll make that motion.
I second.
All right, all those, discussion? All those in favor for accepting the financial reports as presented earlier in the meeting by Cox Holiday and the good news on the audit? All in favor, say aye.
Aye.
Aye. Ann and David?
They're muted, so.
Yeah, they're
Oh, so
muted.
okay.
We
I don't know,
need
hopefully they
your
heard us, I don't know.
Vote
Yeah,
on
hopefully.
financial. Hold on, I'm just texting them.
Some pretty buggy audio today.
Well, we do have quorum, so
Yeah.
we can accept,
Yeah, since all three of
three.
us have already voted. we
Yeah.
can-
so I vote aye.
Aye.
So all those available to vote have accepted the financial reports as presented. Thank you. And Ann also is voting aye. I don't know if you need a screenshot.
And
For the
to,
record.
like
and to
Yeah, we got a quorum.
and to coordinate them,
Yep.
consolidate them.
All right, next meeting is January 14th. I'm actually going to be on vacation
Nice.
in a very different time zone, so I will not be able to dial in. Oh, David also approves. He approves. He was also having tech issues, so
Okay.
we had a unanimous on the financials.
Excellent.
So I won't be here for the 14th, but happy to turn it over to Ann Wynn as vice chair if she is able to.
And I'm not going to be here either. I'm going to be in Mexico, so I don't think that I'm going to be able to dial in.
We
Okay.
need
So-
three.
So you'll still have quorum.
If everybody shows up, if David and Ann and I show up, we'll have a quorum.
Right.
Yeah, and
If
if you,
not, your bylaws are, you can postpone for 1 week, but no more.
okay, well, do you guys want to postpone for 1 week?
That's up to you.
Do you want to postpone for 1 week? Ann says sure.
Yeah, sure.
So you want to change the date then?
We can change the
To the
date to
21st.
the 21st.
All right,
Okay.
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 I'm okay with that.
Yeah, I was willing to dial in from vacation, but it's going to be really early.
We don't want that.
So,
Yeah, I don't think you should have to do that.
All right.
all right,
Seems unnecessary.
thank you.
Sounds like Hawaii or something.
That's exactly where I'm going.
Skiing in Hawaii?
No, not skiing in Hawaii. I'll be
They had
skiing,
a blizzard the other day. you know?
I'll be skiing in Idaho. Actually, you do have skiing in Hawaii on the Big Island.
Yes.
It's not very good. So yes, David, the
Just
21st.
avoid the.
Or Ann,
volcano.
yes, the 21st.
21st of January.
Okay.
I'll be taking that completely over. Don't expect any emails from Gillian. That'll be from me now.
Okay,
All right.
great. Well, thank you, Gillian, for all the work that you've done in
Yeah.
the absence of an administrator and, you seem to be becoming, you're